Good afternoon, guys. For discussion B this afternoon, we are discussing mental health conditions. Here we go. Brief answer. Recent global analysis estimates that over 1 billion people live with mental health conditions, with one widely reported study putting the figure at 1.2 billion in 2023. Mental health disorders are now a leading cause of disability worldwide, and health systems are not keeping pace. Key facts and headline numbers. Estimated people affected. A large 2023 analysis reported about 1.2 billion people living with mental disorders. Who estimates whose 2024-2025 reporting places the burden at over one just 1 second, guys. 1 billion people and highlights persistent service gaps. Burden of disability. Mental disorders accounted for 171 million daily in the recent study, and represents a growing share of years lived with disability. Suicide toll updated. Who estimates report 727,000 suicide deaths in 2021. Why different numbers appear? Scope and methods vary. Some reports count a broader set of conditions: anxiety, depression, ADHD, autism spectrum, etc. Others focus on specific diagnosis or age. Groups. Time frames and modeling choices also differ. That explains why WHO says over a billion, while a separate global burden study reports 1.2 billion. Main drivers of the rise: higher prevalence of anxiety and depression in many regions. Recent years saw notable increases. Population growth and aging increase absolute numbers even when rates are stable. Social detriments: poverty, violence, social isolation, and pandemic related stressors are cited as important contributors. Gaps in care and system capacity, low investment, mental health receives roughly 2% of health budgets globally, with huge disparities between high and low income countries. Who workforce shortages. Global median of about 13 mental health workers per 100,000 people, with far fewer in low and middle income countries. Service model lag. Most countries still rely heavily on institutional care. Fewer than 10% have fully transitioned to community-based models. What this implies and practical priorities: scale up services, expand community-based care, integrate mental health into primary care, and invest in workforce training, prevention, and social policy. Address social determinants, poverty, violence, social isolation alongside clinical services. Data and financing, better routine data, targeted financing, and policy reforms are needed to close treatment gaps. Estimates are modeled and sensitive to diagnostic definitions and data availability. Regional accuracy varies. Underreporting is likely in low resource settings where services and surveillance are weakest. Acknowledgement and summary. The headline the headline is a stark but accurate: over 1 billion people now live with mental health conditions, and health systems worldwide are not scaled to meet that need. This creates a major public health, social, and economic challenge that requires immediate coordinated action. Immediate implications. Treatment gap. Most people with common mental health disorders receive no or inadequate care. Rising disability. Mental disorders are a leading cause of years lived with disability, affecting productivity and quality of life. Inequity. Low and middle income countries and marginalized groups face the largest service shortfalls. System strain. Primary care, social services, and community supports are under resourced and fragmented. Priority actions for urgent scale up. Integrate mental health into primary care. Train primary care teams in detection and brief interventions. Use stepped care models to triage severity. Expand the expand the workforce and task sharing. Scale scale community health workers, peer support, and supervise non-specialists providers to extend reach. Shift to community-based care. Reduce reliance on institutional settings. Invest in outpatient school, workplace, and digital services. Increase and relocate financial financing. Raise mental health budget shares and detect funds to evidence-based scalable interventions. Strengthen data and monitoring. Routine surveillance, outcome tracking, and this this aggregated data to target resources and measure impact. Address social determinants and prevention. Policies on policies on poverty, reduction violence, prevention, housing, education, and workplace mental health. Scale digital and low cost interventions. Evidence-based digital therapies, guided self guided self-help, and telehealth to reach underserved populations. Practical policy checklists for governments and funders. Adopt national mental health plans with clear targets and budgets. Mandate integration of mental health into universal health coverage packages. Fund workforce training and supervision programs to scale. Give me 1 second, folks. Support community organizations and lived experience leadership. Invest in research and implementation science to adapt interventions locally. What communities and organizations can do now? Employers implement workplace mental health policies, flexible leave, and access to brief interventions. Schools embedded social, emotional learning, and early identification. NGOs and faith groups provide low barrier psychosocial support and referral pathways. Guys, people have to support the mental health folks that are out in the community. They need continuous care. Just like elderly people, because a mental health person becomes an elderly person later on. So when they become a mental health person later on in a elderly framework, you have to plug their services back in as an adult. So it doesn't go away. Those kind of things don't go away. It just follows the person into adulthood, into elderly adulthood, and end of life too. It follows them all the way through life. So you have to be able to support their change of life. When things change, you have to change with them. Okay, so with that being said, that is B for you. I will see everybody for C in a bit after a break. For now, Gator Wellness, take care, folks.